Okay, so today we are discussing the revision, histology practical revision, okay, which we have done in the first MBBS, in the first semester and second semester, which will be asked in the first MBBS practical examination from the portion of the histology. Okay, so here I'll show you the slides which are prepared by taking photos of the sections which we have here in the Department of Anatomy. And see here, these are the photos of the sections taken and then put here in the slides to show to you. And in the beginning only, I want to tell this type of photos will be used for your examination if it is happened in online. Okay, discussing. I think you all of you know discussion is going on to take the online examination, but till now there is no any fixed reply from the university. So after they will tell to take the examination, then we'll inform to you and we'll take the examination. Okay. So in the online system, these are the slides. You remember, these are the slides. In the real, it means offline examinations, we used to give you slide under the microscope, isn't it? But in online examination, we have already prepared these slides. We have already prepared the sections, pictures, and these are the pictures which we will share to you, which we will give to you during the online examination. Okay. So now you have to practice on identifying the different histological tissue, different histological cells in this type of the diagrams. Okay, which we are discussing in histology, and later we'll discuss in embryology also. Before we have discussed in the osteology. Okay, all these things you have to practice. So saying this, now I'll start the discussion. First of all, we have to see the epithelium, because in the first semester, in the beginning, after the cell, we have done the epithelium, isn't it? We have seen the different types of the epithelial tissues. So first of all, we are doing the simple epithelium. So in simple epithelium are different types, isn't it? Simple epithelium are different types, and first one is the simple squamous epithelium. Simple squamous epithelium. Okay, see this first diagram. This one is the first diagram. This one is the simple squamous epithelium. I'm telling here, but some of the things I'll ask to you, so you see properly the diagram. So on what basis I'm telling this simple squamous epithelium? Because in examination, if we want to ask simple squamous epithelium, same thing I'm going to keep. Okay, I'm going to put the same thing. So now you have to see this thing. You have to practice this thing. Okay. So see here, this one is the pointer. This one is the pointer. You see the pointer. Where the pointer is pointing. What is this structure? Can you tell what is this structure? This whole structure. What is this one? Some of you, any one person, no need to speak all. I'll pick up some of the things. Prasidi, you are here in the on the top in the list. Okay, the participants. So can you tell what is this structure? This whole structure, first of all, you tell. You have already done this also, isn't it, in the renal system? So this clue to you. So what is this? Can you tell this structure?
Sir.
Yes, please try it. Yeah, this is glomerulus. Okay, see inside you can see capillaries, and outside this is the Bowman's capsule. Bowman's capsule is lined by the simple squamous epithelium. See here, small flattened nucleus you can see. Okay, in the flat cell lining the Bowman's capsule from its inner side, isn't it? See, this one is the simple squamous epithelium. We have taken the photos in 10x, so the cells are looking very small. Already I have told to you, okay, I have told to you, we'll keep the same diagram, okay, so you should not be confused during the examination. Now we are not taking other set of the diagram. Take more new diagrams now. Same picture will be shared to you during the examination if we want to ask simple squamous epithelium. So here these lines represents the flattened cell. Okay, within this line blue dots overlapped by the red ink after I am writing here. So this is the simple squamous epithelium. Okay, you have to write the cardinal features. at least 3 cardinal features, because see, the weightage of the supporter in the online system of the examination may be increased, because here in the real means online also will be real, but here in the our before type of the examination, traditional type of the examination, we used to give 20 supporters. This may not be possible to be asked in the online system of the examination. So we'll decrease the number of the supporters. We are thinking like this. Okay, we already hold on HOD meeting there. We discussed a lot. Okay, and from the side of the department, I am thinking like this. Department of Anatomy, I am thinking like this, to decrease the number of the supporter. And if the number of the supporter decreases, then weightage of each supporter will be increased. Okay, if the weightage increase, then along with the identification, you have to write a little bit more. Okay, before we used to ask 2 cardinal features at least, but now you can expand. Okay, you can write more than the 2 points, 3 points, 4 points, whatever very significant point related to that particular structure which you are identifying, which we are giving there into the exporter. Related to this, you have to increase the number of the points. Accordingly, will provide you time as well as, okay, for one exporter we may give to you more than 1.5 minutes. Before, for the exporter, we used to give to you 1.5 minutes. Okay, that includes identification as well as writing the cardinal features. In the histology I am talking, okay, gross part we'll discuss later in the gross class. So here, more than 1.5 minutes we may give to you 2 minutes or 2.5 minutes. Okay, so that you can write more than 2 points. Okay, so these rules again, after university's ruling, okay, after university's information, again we'll sit and discuss. Okay, we'll come there into you in the via these teams, and then again discuss to you. Okay, all the rules regulation before the examination. But see, now you have to focus in the cardinal in the identification of these pictures, and you have to make up this mind. You may be writing more than 2 points. Okay, and now see, what is the second slide? You can identify now. If I start to identify everything, then your involvement will be not very active. I want your active participant, because this is revision practical class. We have already taken it, so you can also answer it. I'll pick up some of the guys. If I start to ask to everyone, then there will be echo problem. Okay, if we start to speak together, then one by one I'll ask. After proceed, I'll ask to Suraj. Suraj Acharya, are you seeing the second slide? What is this one? Yeah, pointer. What it is showing? Pointer is showing something. Okay, what is this one? On the basis of first MBBS study, you have to tell. You may confuse. See, I'm alerting all of you. See, you may confuse because you already have seen the section of this tissue, and you have studied whole tissue together, isn't it? You have finished the, I think, endocrine system histology as well, isn't it? Renal system histology as well. So you may confused because you have the mixed up knowledge now. First MBBS knowledge, second MBBS knowledge, and you may tell this one, first diagram, the kidney, section of the kidney. It is right, but see, for the first MBBS, you no need to write kidney. Okay, we don't want this answer. If you write kidney, you'll get no marks. Okay, you'll get no marks. So you have to be very particular about your first year curriculum. Accordingly, you have to give the answer. So similarly here, I'm just asking the Suraj, what you are going to tell the Suraj? Second slide.
So simple cuboidal epithelium.
Very great. Yes, this is the simple cuboidal epithelium. But you have also done the thyroid gland histology, isn't it? Have you done it or not? Endocrine system. Is it over? No. No,
No,
I
sir.
think not. We are running the urinary system. We are running the urinary bladder now. So after this urinary histology will do. Yes, even this is also not done. Then we'll go into the endocrine. Okay, then there is no confusion if it is not done. But some of the part of the histology of the third semester already covered, isn't it? GIT it is already covered. After the GIT, hepatobiliary it is covered. So some of the tissue from the GIT we may give for some of the epithelium. So that time you should not confuse. I think in next slide you'll find this type of the thing. Okay, this is the simple cuboidal epithelium. Very good. It is lining the thyroid follicle. Okay, it is lining the thyroid follicle. See, this is thyroid follicle, this is thyroid follicle. Thyroid follicle lines by the simple cuboidal epithelium. And features, I think you know it. It is having the length and breadth same of the cell. Okay, cubical cell you can say, and inside the cubical cell, what is there? There is the very peculiarly round nucleus in the central position, isn't it? And after writing this thing, even you can write it is resting on the basement membrane. This basement membrane thing is common to every epithelium, not only for the squamous, not only for the cuboidal, but it is for the columnar and for other different transitional all the epithelium. Even though you can write this thing, because basement membrane indicates the this is epithelium. Other than epithelium, there will be no basement membrane. Other tissue there is no having of the basement membrane. So even though common for the different types of the epithelia, you can write the basement membrane also. Okay, and after writing the cardinal features, 3-4 cardinal points, 3-4 important points related to this tissue, then you have to write the distribution example of that tissue. This is very important to score the good marks. Simple squamous epithelium is lying there in the Bowman's capsule. Not only there, it is also present there in the inner lining of the blood capillaries as the endothelium, isn't it? Also, it is present there in the inner lining of the body cavities. You can say pleural cavity, and you can also say what is the endocavity, pericardial cavity, peritoneal cavity. All these are the examples of this epithelium. Even function also, if you want to correlate, you can quickly write in one point. Okay, see, simple squamous epithelium most of the time. See, it is doing the in some of the cases filtrating filtration. Okay, here you can see it is doing the filtration in this kidney. Okay, and if you see the simple squamous epithelium of the, you can say in the lung also, alveoli also lined by the simple squamous epithelium. There it is doing the diffusion. So this type of the functional part you can always correlate in a very brief point. I'm not telling to explain it because in the practical examination you cannot explain it. Already have given the theory examination. No need to bother about explaining now. But very concisely, very eminent point, very powerful point. Okay, so that you can score the good marks. This point you have to select and write. All right, are you hearing to me? Is it going well? Yes, I hope so. You are understanding the thing, even though you do not speak, you did reply. So see, this is the simple cuboidal epithelium lying there in the thyroid follicle, and what is the end of distribution in the duct system of the gland, like parotid gland. Okay, there are striated duct. It is present there, isn't it? And in the PCT, DCT, tubules of the, you can say, kidney. Here only you can see all these are the tubules of the kidney. Here also these things are lying. Okay, like this you have to write. Uh, I'm again guiding you the same thing which we have guided you before in the histology classes. Now, first come to the identification of the other slide. After this, Suraj Suman, are you there, Suman? Suman. Hello, Suman. Suman is not answering. He must be just giving the attendance. He didn't bother more about the identification of the things. If you do like this, you may suffer during the examination. Do not do this type of the things. After this, Suman, I'll go to the IUC. IUC, are you there?
Yes, sir.
Yes. Can you identify the number three structure? What is this one? Number three structure. Yeah, pointer. You have to see the pointer. Okay, big particular about the pointer. If pointer is showing in your diagram or in your section, do not confuse this. Pointer is there, so you have to say only the name of the tissue which is pointing. Okay, what is this tissue? Which epithelium? Here it is epithelium. You can see it even here also. You can extend it to the other side even here also. What is this epithelium? Can you please tell it? I see. You try it.
Sir, transistor.
transitional. No, it is not transitional. Because see, it is lining the GIT. Okay, it is the epithelium lining the GIT. So this is the simple columnar epithelium. Okay, simple columnar epithelium. Now onward, everybody do not forget it. Okay, no problem. I see. Now you learn it. Okay, this is the quite different pictures we are giving to you than showed before in the section. So you may be confused, but now onward you do not confuse. What is this one? Third one, simple columnar epithelium. See here, the height of the cell is taller than the breadth of the cell. You can see each and every cell, and inside you can see a nucleus, oval nucleus, okay, which is away from the basement membrane, and even you can see this is the epithelium from the GIT. So microvilli you can see, okay, microvilli you can see, and some goblet cell also you can see in between. Okay, all these are the features of the simple columnar epithelium. Now I'll go to the number 4. I have to finish so many things. Already time is 27 minutes done. So I'll go to the number 4. What is this one? Number 4, another person. Just a minute. I'll pick up the person. After the I see Shreya. Shreya, you can tell. What is the number 4? Just try. If you do wrong also,
Sir,
no problem. No problem. Yes. Yes, please. What is this you are telling?
pseudo
I am not hearing. Pseudo-stratified ciliated columnar epithelium. Good. This is the pseudo-stratified. Now you can mute your mic. This is the pseudo-stratified ciliated columnar epithelium. Okay, because see here you can see the cilia. Even though nuclei are not very prominent here, difficult to find here. This is the picture taken from the pseudo-stratified ciliated columnar epithelium. But cilia are very prominent, and in between you can see goblet cell, and nuclei are not prominent, but you have to write, see, cell layer will be the single, but the position of the nuclei will be the different, so that will give the false false stratifications. Okay, actually single layer, but two strata, two layers you can see, because of the different position of the nuclei, because of the different size of the cell. Tall cell will be there, tall short cell will be there, small cell will be there. Okay, like this you can write for this. It is the epithelium of the respiratory system. Do not forget it. It lines the trachea. It lines the some part of the larynx. Okay, even part of the epiglottis. Not all, but some part. You learn this properly. Everything I cannot detail now. And then even it is lining the some part of the male reproductive system, like epididymis, and what's the other one? Doctor's difference also, isn't it? So distribution you have to learn. And I'll pick up the end person. These two epithelia are quite confusing to you. Simple columnar and the pseudo-stratified ciliated columnar epithelium. You see this slide. I'll share this slide. Okay, you see these slides again and again. Okay, so that in examination you will not be confused in the identification. If you identify, you can write the cardinal features. This I know. Now after the Shreya, I'll go to the Sahamad. Okay, Ahmad Sahamad. Are you there? Listening to me, Ahmad? Hello, Ahmad. Can
yes,
you
sir.
speak? Yes, yes. Okay. If I spell your name wrongly, please excuse me. Okay. So what is this one? Which diagram is this? Fifth, right? Is this fifth? We have already discussed four. Yes, this is the fifth. So what is this fifth one? Can you identify this epithelium? Can you identify? Please tell if you know. If you don't know, also you try it. What's there in trying? Okay, this is not real examination. You can try. Okay, what is this one? What is this one? What you are seeing? See here, inferiorly you are seeing the epithelium, and here on the surface you can see the keratin layer. So this one is the keratin layer, and this one is the epithelium. Okay, and you are seeing the stratified epithelium. So what may be this? What is its correct name? How to give the name?
keratinized stratified squamous.
Yes, keratinized stratified squamous epithelium. Good. This is the keratinized stratified squamous epithelium. Okay. So what will be the cardinal features? See, in the surface there is the keratin layer, thick keratin layer. You can see keratin layer formed by the dead cells, dead squamous cells, the dead superficial cells joined it. And here in the epithelial layer, you can see multiple layers. This is the basal layer, we'll say simple columnar epithelium will be there. Then about 5 to 6 layer of the cells will be the polyhedral cells having the rounded nucleus. Okay. Then superficial layers of the cells, 2-3 layers of the cells will be simple squamous cells. Okay, this thing you can write. And its distribution will be the, what is the distribution? Keratin layer. This is the epithelium of the you can say skin. Okay, you can say skin. This is the epithelium of the skin. Okay, now come to the number 6 and the person. I think I cannot pick up every person. If I start discussing like this, we cannot finish the today's target. Shishir, you can try till the some few minutes. You can try. Then I'll only do it. Okay. What is the
So
number 6?
non-keratinized, non-keratinized
Yes.
squamous.
Yeah, yes, good, good. You're right. Shishir, yes. Why it is non-keratinized? Because no keratin there. There is no keratin there, and you can see a stratified squamous epithelium, and the structure of this epithelium also similar to this one. Only the exception here is there is no keratin there. Isn't it? And then distribution. Can you tell what is the distribution of this one? Where it is lying? Shishir,
Thin skin.
you can tell. Thin skin. Better to say, better to go to the more clear point. You can give the example of the esophagus. Okay, there it is. And then this is actually not the slide of the thin skin. It is there, but see this type of epithelium in the thin skin. But this is not the section from the thin skin. This is from the esophagus. Okay. In the thin skin, I'll show you later towards the end of the our session today. There will be the follicle. Here follicles you see in the thin skin. Here there are in the thin skin. In the thin skin, thin keratin there you can find. Okay, not thick as much as of the thick skin, but thin keratin there will be there. Okay, so already I have mentioned skin. Skin means both the skin, not only the thick. Okay, even thin also. It will be of the fifth variety. Now esophagus you can tell, and then you can tell oral cavity, and you can tell lower part of the even anus. Okay, it is there. Okay, so this is the number 6. Now I'll go into the number 7. I have to manage time for all the slides, so I'm discussing more about the same slide. And now 5, 6, 7. So what is this and the person? I'll pick up the sum of the person. Yes. And after the Shishir who is there in the queue, Kushal is there. Kushal, Kushal, can you tell it? What is this one, number 7? The pointer where it is showing?
So transitional epithelium.
Yes, great. Yes, this is the transitional epithelium. I hope you know the all the features of the transitional epithelium. See, it consists of the quite peculiar type of the superficial cells. These cells will say the dome-shaped cell or the umbrella-shaped cell. This you can write. Basement membrane will be there. In between there will be polyhedral type of the cell, and towards the basal side means here there will be the simple columnar type of the cell. This all you can write in the structure point of the view. And now distribution. What is distribution? You can tell what is the distribution. Who was telling the answer before? Kushal, isn't it? Kushal Singh Basnet. What is the distribution? Where it is lying? Distribution means where it is present.
So urinary bladder, urethra.
Yes. Urethra better to be avoided. Okay. You can
Ureter.
give the example. Ureter you can tell, because if you see the male urethra, in the male urethra you will find the different types of epithelium. Only in the prostatic part of the male urethra you will find this epithelium. If you go to the down part of the urethra, there will be another type of epithelium. In urinary system, we'll discuss in detail. I don't want to talk it now. So urinary bladder, urethra, okay. Oh, sorry, ureter you can say, and if you want to say urethra, prostatic part of the male urethra you can say. If you go to the female urethra, it is not lining. Okay, it's lined by these stratified epithelium there in the urethra. So these are the distribution. And now come to here and to the eighth number, who is there in the queue. If you have identified yourself in the queue, you can tell. So that will save my time of going
Adipose
there.
tissue.
Yeah, Vijaya. After Vijaya, Diksha will be there. Okay. So please remember your queue and you can quickly tell it. So this is the adipose cell. Adipose tissue, you can say. Yes. So what will be the cardinal point here? What you are writing? See, cells are empty. Okay. And its nucleus is lying to the one corner of the cell. So giving the cell the shape of the. You can mute your mic, please. If necessary, then you can unmute and speak. Uh, yes, some sound is coming. Yes, you can mute your mic. And then because of the position of the nucleus, the cell it is said having the signet-ring appearance. This point you can write signet-ring appearance of the cell. Okay. Uh, Other than this, the distribution it is everywhere in the superficial fascia. You can say in the omentum it is lying. You can say it is storing the energy. Okay, or it is also insulating the body. These are the functions you can write. Now come to the number 8, and who was there in the queue? In the queue, who are there?
Yes, sir.
Yes,
Hyaline
yes,
cartilage.
yeah, yeah, hyaline cartilage. Yes, Diksha. Okay, hyaline cartilage. This one is the hyaline cartilage. Good. So hyaline cartilage. What are the points you have to write? You can write this is having the. You can say lacuna. Within the lacuna, there are the uh, nest of the chondrocytes. Okay, and here in between the nest of the chondrocytes you can see matrix two varieties. You can say only the territorial matrix, which is more bluish. Okay, here around the cell nest, and in between the cell nest interterritorial matrix, this is quite lighter than the territorial matrix. All these things. Okay, and even perichondrium, presence of the perichondrium, you can say. Okay, so these things you can write. And distribution very widely distributed in the body. You can find it in the articular cartilage, you can find it in the costal cartilage, you can find it in the laryngeal cartilages. So this distribution you can always write. And then Arindam, are you there? Can you try? What is number 9? Number 9, what is this? Arindam, are you listening to me? Oh no! If you are not replying, then you listen to me. Everybody listen to me. Now I'll speed up the things, okay? Because now 20 minutes, about 20 minutes left. Within 20 minutes, we have to finish a lot of the things. So now I'm speeding up and showing to you and telling to you the necessary things. This one is the elastic cartilage. Okay. Before I tell, you can guess yourself and you can check yourself. Okay. You'll see the PowerPoint before I start telling. So you guess yourself what is this, what is that, and you can examine yourself whether you will be possible identifying the structures or not. Okay, you are able to identify the structures or not. So this you can examine yourself. So this is the elastic cartilage. The elastic fibers are there. Cell nest are small. Okay, and they are having these single chondrocytes in the cell nest. Isn't it? Perichondrium is present, isn't it? And more eosinophilic matrix is there. So that this is the elastic cartilage. Distribution will be in the pinna of the ear, epiglottis. All these are the distribution of the elastic cartilage. And now number 9, everybody you guess it. What is this? Now I'm telling. This one is the white fibrocartilage. Okay, this one is the white fibrocartilage. Okay, here is white fibrocartilage because see here you can see bundle of the collagen fiber. Bundle of the collagen fiber. In between the bundle of the collagen fiber, you can see rows of the chondrocyte. Okay, see here, this is the chondrocyte. This is the chondrocyte. This is the chondrocyte here. Small cells you can see here. These are the chondrocyte, and this is present in the you can say intervertebral discs, IV discs, intervertebral discs. This is a good example of the white fibrocartilage. Not only this, in the some menisci of the joints, like menisci of the knee joint, you can find this. Okay. Now another slide. This one is the quite faded, but you have to identify this. This also you can give to you in the examination. This is the spongy bone. Okay, here what the cardinal features which you have to write. Spongy bone consists of the trabeculae. See here, all these are the trabeculae. All these are the trabeculae of the spongy bone. Yes, and in between the trabeculae, you'll find the bone marrow. See, this one is the bone marrow, and there is no Haversian system. All these things you can write in the bone marrow. You can see bones, blood cells, white blood cells, red blood cells, and even some adipose tissue. Also, you can find here. These are the things you can write here. Okay, and now see, these are the two sections of the. All of you know it, but I'll tell. You also guess it. This one is the compact bone. Okay, this is the LS of the compact bone, and this one is the TS of the compact bone. This you have to identify. This is LS because see here you can see longitudinal canal. See this one, and then this canal is known as the Haversian canal. Yeah, this one is the Haversian canal, and here these black dots are the lacrina consisting of the osteocyte. All these are the lacrina consisting of the osteocyte. These things are there, and how to differentiate it with the TS or CS? Even CS also you can write. Here you can see cross section of the Haversian canal. See here, this is the cross section of the Haversian canal, and this is the Boltzmann's canal. Boltzmann's canal connecting to Haversian canal. Okay, and you can see concentric arrangement of the lamella. See here, this one is the concentric arrangement of the lamella forming the osteon. This is known as the osteon, osteon or Haversian system. All right, and black dots. These black dots are the osteocytes. This also you have to write. Okay, please practice these things. And now come to here into the end structure. Here and the structure is the what is this one? Muscle. Now we are discussing the muscle. Yeah, this one is the skeletal muscle. Very faded section. But you learn now. This is the skeletal muscle. Skeletal muscle. Which part of this? Which section? Cross section. CS of the skeletal muscle. Here, this is the LS, longitudinal section of the skeletal muscle. Okay, and here you can see these are the fibers of the skeletal muscle. Peripherally placed nuclei, you can see multiple nuclei will be there, and you can even though not visible here, the striations, presence of the cross striation, longitudinal striations, everything you can write. Similarly, it is covered by the different types of the connectivity will be same, but according to this arrangement, it will be explained as epimysium, perimysium, and endomysium. This also you can write. Okay, so this is the skeletal muscle. Now see, this is the section of the which muscle. You can easily guess. This is the smooth muscle. This is the smooth muscle. Okay, here you can see LS of the smooth muscle. Here you can see CS, cross section of the smooth muscle. Probably it is taken from the GIT. But no need to write CS, LS in this part. You simply write the smooth muscle and explain the spindle-shaped type of the fibers are there, and within the spindle-shaped fiber there will be oval centrally placed nucleus. Okay, and striations are not visible here because of the random arrangement of the filaments within the muscle fiber. So this point you can write, and distribution you know it is lying the gut wall, it's lying the, you can say, urinary tract, you know it. Okay, so I need to elaborate more about the distribution. And now what is this one? The diagram here is the cardiac muscle, CM, cardiac muscle. It is also faded, but now you have to practice this. This faded diagram is the cardiac muscle. On what basis I am telling cardiac muscle is C. This is on muscle fiber, and it is anastomosing with the end muscle fiber. Here you can see anastomosis. Okay, here you can see anastomosis. All these are the anastomosis of the cardiac muscle fiber. If you look very properly with focused eyes, you can easily make out the anastomosis. You can easily see it. Intercalated discs, they are not visible, but somewhere I am locating them. See, these all are the intercalated discs. Again, this also you can write, and nucleus will be centrally placed. This also you can write, and it is present in the heart. Okay, myocardium of the heart. This you can write. Yes. Now coming to the end of the slide. I don't know how many slides are left. Still more. So I'll only discuss if time permits you to identify at first. Then I'll give you the chance to identify in the class only. If not, also you have to work out by yourself. Just a minute. Yes. What is this one? Now, yes, this one, faded section here. What is this one? Now, whole class, whoever first you can tell it without picking it up. The person. What is this one? Can you tell quickly? If you are wasting time, I'll not give you a chance because I have to finish a lot of the things.
PS of nerve fiber.
LS of
Yes.
nerve.
Oh, this one, first diagram. This is TS of nerve, not LS. Okay, this is TS of nerve. This is TS of nerve. Okay, don't confuse. This is TS because see here you can see all sections of the bundles of the nerve fiber. See here, this is one bundle. This is another bundle. Okay, and this is another bundle of the nerve fiber. This is another bundle of the nerve fiber. If you see it properly with your focused eye, you can easily make it out. Okay, so all these are the sections of the nerve fibers, or bundles of the nerve fiber, transverse section or cross section. And here there will be small nerve fiber. These things it is not seen here properly because of the fading of the section. In the exam, you write this is the TS of the nerve fiber and write down all the things like it is covered by the here we'll say epineurium, perineurium, and the endoneurium. Similarly, there will be axon in between, okay, and laterally there will be you can say myelin sheath, okay, and Schwann cell also you can write in between nuclei of the Schwann cell also you can see, and here and the section is the this is LS, okay, this is LS of the nerve fiber. See here, all these are the osmic acid stained nerve fiber, okay, so they are looking very dark. The myelin sheath which is around the nerve fiber will take the osmic acid stain and it will be dark in appearance. So all these are the nerve fiber having the myelin sheath. For the cardinal feature, you can see the dark part is the myelin sheath. Okay, the dark part is the myelin sheath, so obviously it will be the nerve fiber. Yes, and inside there will be the axon. This also you can write, and similarly you can see endoneurium here, okay, and perineurium would be there, okay, and then outside covering will be the epineurium. All these things you can write, and node of Ranvier also you can see here. This is node of Ranvier. This gap is the node of Ranvier. All right, so this gap is the node of Ranvier. This also you can write. Okay, now coming to the ganglion. What is this ganglion? Some of you can contribute your answer. I think now we are controlling our class with the time, in relation to the time, so you can also tell the answer. What is this one? Yes, right. Whole class I am asking now, not picking up anything. Whoever first will answer. Huh? Spinal ganglion. Yes, spinal ganglion. Good. Spinal ganglion, also known as the dorsal root ganglion, also known as the, if you want to write, and the one sensory ganglion. Okay, so any name you can write, because see what is the peculiarity of the sensory ganglion, this dorsal root ganglion or the spinal ganglion. You see the neurons, cell bodies of the pseudounipolar neuron will be locating there into the peripheral side. See all these are the collection of the neurons. So many neurons here you can see, more towards the periphery, in the form of the groups here towards the periphery. Okay, and the neuron will be round. The cell body of the neuron will be round, and it is having the centrally placed nucleus. So this thing you can write. And towards the center, what is there then? See, towards the center you will find the fibers. Okay, nerve fibers are there. Okay, more nerve fibers are there towards the center, and groups of the neurons are there towards the periphery, and neuron cell body will be the round in shape, having the centrally placed nucleus. Okay, and now what is this one? Next one. This one is the sympathetic ganglion. Sympathetic ganglion, also known as the autonomic ganglion. Okay, here you can see multipolar neurons scattered randomly in the peripheral side also you can see, and in the central side also you can see. Okay, neurons are randomly scattered everywhere they are. Okay, and multipolar neuron. And if you see the nucleus with a good slide, then the nucleus will be peripherally located. Off central nucleus you can write here. And even you can say satellite cells are there circling. Satellite cell will be here in both the place. Okay, DRG also, and even in the DAG also. Okay. This thing you can write. This is lying there in the sympathetic chain, or in the some autonomic plexuses. You can write the distribution. Now come to the cardiovascular system. In the cardiovascular system, you are doing only the 4 sections. The 4 sections will be the first of all, see, this one is the large size artery, also known as the elastic artery, Here you can see this the tunica media. Within the tunica media, you can see many layers of the elastic fibers. Okay, elastin, you can see less muscle fiber but more elastic fiber are there in the tunica media. Okay, this is the cardinal feature of this artery, elastic arteries. All right. Also known as the large size artery. And outside adventitia, these 3 layers always you have to write other than this. Okay, first of all you have to write 3 layers. This is the adventitia. Okay, this is tunica media, and this one inner side, this one is the tunica intima. It is lined by the endothelium, squamous epithelium. So this point we can write here. Now this one is the medium-sized artery. In the medium-sized artery, here also you can see tunica adventitia, tunica media, and what this one, tunica intima. In the tunica media, see here you'll see more muscle fiber, less elastic fiber but more muscle fiber. Smooth muscle fiber will be more here. Okay, this artery is also known as the function-wise distributing artery. Okay, so more muscle fiber is required here. And here, what is this one? This one is the blue layer. Are you seeing the? I'm seeing it. I think you can see the blue layer. This is the internal elastic lamina. Internal elastic lamina in case of the medium-sized artery is very prominent. So at this point you can write prominent internal elastic lamina is thrown into the fold because of the post-mortem contraction of the, you can say, a contraction of the, you can say, the elastic muscular artery. This point you can write. Very strong point. Okay, now come to here into the vein. This one is the large size vein. Okay, this one is the large size vein. Large size vein cardinal feature in the tunica adventitia. You can see the longitudinal arrangement of the smooth muscle fiber. See here, all these are the smooth muscle fibers which are arranged longitudinally, and within this you can see small blood vessels also, vasa vasorum you can say it. And tunica media is comparatively thinner than the tunica adventitia here, and this one is the tunica intima. Okay, so this is the cardinal feature here. You can write this point. Longitudinally present muscle fiber in the tunica adventitia. And here, this one is the medium-sized vein. This one is the tunica intima, very thin, and tunica media. You can see here, and what is this one? Tunica adventitia, almost similar in thickness. This part you can write here as the cardinal feature. And lumen is like it is not round. You see, if you see the artery, lumen will be round. Here it is not round. Lumen is having different shape. Okay, because the vein will be easily collapsed. Then the artery, this feature also you can write here. Okay, and always there will be lining epithelium, the endothelium. This point also you can write. Now come to the lymphoid organ. The first lymphoid organ which you are seeing here is the lymph node. See here, this one is the lymph node. Lymph node, you can see lymphatic follicle. See here in the cortex. These all are the lymphatic follicle. Okay, lymphatic follicle. In the cortex, you can see lymphatic follicle. Other than this, if you go towards the medulla, there will be the lymphatic medullary cords. Okay, and if you go in between the medullary cords, there will be the sinuses. Okay, there will be the sinuses. So these points you see again in the text, your notebook, and write down this thing. But identification, you have to focus here. And now what is this one? This one is the tonsil. This one is the tonsil. This is actually lingual tonsil. We used to say tonsil. Here, how to identify as tonsil? Because here you can see epithelial lining is the non-keratinized stratified squamous epithelium, and this one is the tonsillar crypt. Many crypt you will see. This one is the tonsillar crypt, and here around the tonsillar crypt you can see lymphatic follicle. See here, this one is the lymphatic follicle. Okay. And you can also see the some lingual gland part here, but this is not the part of the lingual tonsil. It is lying quite deep into it. Okay, so these points you can write here, whatever I told. And the follicle and crypt you can write there. Now this one is the thymus. Thymus, how to identify? See, thymus is having the different lobules. This is one lobule, this is another lobule, this is another lobule, okay, this is another lobule, this is another lobule, separated by the, well, you can say here different septa, okay, all these are the connective tissue septa. And each lobule consists of the outer part. This outer part is known as cortex, and inner part is known as medulla. This you can write. And it is mentioned within the medulla. If you see it very properly in the good section, there will be the presence of the Hassel's corpuscle. This you can write even though you are not seeing the section, but here it is. Okay, see, I'm picking up on Hassel corpuscle. This one, the Hassel corpuscle. I have overwritten the ink. Later you can see it. There will not ink. Later you can see it after I share you the slide. This point you can write in the finals. And what is this one? This one is the yes, spleen, isn't it? This one is the spleen. Here you can see white pulp. See, this is white pulp. This is white pulp. This is white pulp. And here in between the white pulp there is the red pulp. Okay, red pulp, and then sinusoids also. You can see all these are the sinusoids, and you can see even central artery. See, this one is the central artery. So all these things you can write in the spleen. After this, come to the what is left? Yes, gland. Even glands also there. Time is very less. I'll quickly tell to you. Just identification I'll do. Cardinal feature you can write. This is the which gland? This is the mixed gland. Sorry, this is the serous acinus. You have to write acinus. Okay, this is the serous acinus. Find out the cardinal feature in the textbook. And this one is the which acinus? Mucus acinus. This one is the mucus acinus. Yes, and then what is this one? This one is the mixed acinus. Okay, here you can see demilune, serous demilune, so it is called mucus acinus. Okay, now come to the respiratory system. In the respiratory system, this is trachea. There is the cartilaginous plate, hyaline cartilage. Okay, epithelial lining is the pseudostratified sedated coronary epithelium. So this one is the trachea. Okay. And similarly here, this one is the lung. You can find this is the lung because here bronchus, this is bronchus, and here these are the alveoli. Okay, honeycomb appearance of the alveoli. So this one is the lung tissue. And now this one is the skin. Which skin is this? This is the thin skin. See here, hair follicle is there. This one is the thin skin. This is epithelial lining, and thin layer of the keratin you can see there. Okay, so this one is the thin skin. Okay, this is the last slide. We have done it. See, this is the last slide. This last slide is of the thick skin. Thick skin. Okay, here epithelial lining, and then here you can see keratin layer. Okay, epithelial lining with the keratin layer you can see. At the same time, what is actual time now? Here it is sort of 58 minutes, but I'm not trusting these words which is showing there in my laptop. Still, we may be having the 5 minutes more, isn't it? Can you just check the time? Nepali time you have to check because we are depending on Nepal's time to take the class. What is time now? Some of you can tell to me. Still time is there? Huh?
Yes, sir.
This minute.
10:53.
Okay, we have enough time. See, this recording confused me because here in the recording it showed 59 minutes. So I went quickly. That's yes, it's confusion to me because of recording time. If we have 7 minutes, then now we can discuss. These all are the slides which you have to prepare for the first MBBS examination from the histology portion. Okay, I'll not give you the question outside from this. Okay, whatever histology slide in the online examination will come from this only. Whatever I have projected today, I'll share this. You please make sure yourself, everybody, all the 100 people, make sure of the identification of these things, these sections. Cardinal features already we have done it many times, isn't it? Again and again we did it before. Today also important cardinal features I have told to you. So again read these things, again prepare these things. As already I have told to you, you make more than 2-3 points because the weightage may be more, slightly more than the before examination pattern. Okay. So any questions, any doubt now you can ask with me. Any questions you are having? Some of the students, any questions like how to prepare, how to tackle the online examination, or regarding these sections, if you have any questions, any doubts, you can ask with me now. No questions? This is sad part. See, so many slides I have showed to you. 100 of people are there, okay? 94 are there now. At least for the attendance, some people are joined towards the end of the class. And you are not asking any question. You can ask. No doubts in the 100 heads. Oh my God! Always you are keeping me, because if you are not asking the doubts, we think we are the supreme teacher of the world. No doubts with the question, with the students. Then I'll ask. Okay. Some of the guys I'll pick up. Yes. We have reached till to the Arindam. Now, Ansel Chaudhary, are you there listening to me?
Yes, sir.
Yes, now you can give the answer of this thing. Towards the end, I went very quickly. So some of the important thing I'll ask to you. Yes, here, this slide. What is this one? First slide, which is projected. What is this one? Are you seeing the slide?
So it is lymph.
Yes, lymph node. Very good. This is the lymph node. What are the cardinal features you are going to write in the lymph node? Can you say cardinal features? What is this one which you are seeing? I have encircled here. What is this one?
It's a cortex.
Oh, this is a lymph. It is cortical part. Now here you are seeing the cortical part. This is the cortical part. In the cortical part there are the lymphatic nodules. Okay. Yeah, in the cortex there is the lymphatic nodule. Okay. Inside there is medulla. See, this part is medulla. Okay. So these are the lymphatic nodules. You can write. And then here in the medulla, what you will write? In the medulla, what you will write?
It consists of medullary cords.
Yes, yes, medullary cords. All these are the medullary cords here, even though not very properly seen because of the faded section, or while taking the photo, this type of the shadow is coming. Here, all these are the medullary cords. In between the medullary cord, what will be there? Medullary sinuses. Okay, and there will be trabeculae here. Trabeculae is not. Yeah, here you can see this is capsule. Okay. Fibrous capsule you can see, and in between the capsule and the cortex here you can see pericapsular sinus. This also you can write. Okay, and from the capsule there will be extension of trabeculae to the inner side, isn't it? And around the trabeculae there will be the peritrabecular sinus. This also you can write. In the sinus there will be flowing of the lymph. Okay, all these points you can write. Very good. You have tried good. Okay, then and the one more guy I can pick up after the answer. Bridge Mohan Chaudhary, are you there? Bridge. This is here. I'll not ask now. You can identify this section. What is this section? Second section.
So it's one.
Yes, spleen. Good, good. You are identifying. So this is the section of your spleen. So what are there in the spleen? What are the features you are going to write?
There are red pulp.
What are these?
White pulp.
Yes, this is white pulp. Okay, and this one is the red pulp. Around the white pulp, you can see central artery, which is overriding by the red ink here. Later you can see. I'll clear all the ink and then share to you. And in the red pulp, what you can see? What are there in the red pulp? Splenic cords, also known as Billroth cords, isn't it? These are the cords formed by the lymphocytes. This you can see. And then in between the cords, what are there? There are the sinuses. Within the sinuses, you can see the red blood cells. These things also you can write. Okay, filtrating part of the spleen you can explain in brief, very brief. You don't need to detail the explanation in examination. You can do it within 2 minutes. Or 2.5 minutes, whatever time you provide. Briefly, you can write all these very essential structure. After this, still I'm watching time. Yeah, it's now 11. So I hope you all at least can identify the sections, all the sections. I have given you 5 sections. You can count it and prepare all these sections properly. Okay. So shall we wind up now then? Just a minute. I'll
Yes,
take
sir.
the attendance. Okay, I'll download the attendance. There is no task today because this is the revision class. Task is you have to prepare for the examination. This is the task. Okay, so this much for today then.